I'm really excited to talk about this particular topic, specifically because one of the foundational things I wanted to do with my practice when I started functional medicine was to understand aging process and give people tools to try to get them to age well, which we'll talk about what that looks like. But a lot of people are nervous about losing their independence, and they always ask me, what is the one thing that I can do? What is the one thing that I could change? And it comes down to very fundamentally something that's in our control, because there are things that we don't have controls of, like our genes and maybe our environment, the water we're drinking, the air we're breathing. But what we do control is our lifestyle choices. And that is the number one thing that we can do on a daily basis, is to change our lifestyle choices so that we are doing things favorable for our aging. And so I just want to give a background on how I got to here. This is my 31st year in medicine. And the reason that I started to change my type of practice, I started off in a traditionally trained internal medicine program in Boston, and it was it was excellent to prepare me for the urgent things that happen, when people are having critical issues. Of course, traditional medicine has its value. I would never say that people should forsake any of that. I think that it's limited though, because my personal journey happened because I always was tired. I was a young doctor with two kids, and I did a ton of call and work, and I just really disliked being tired. And so at some point in my life, I became very sensitive to eating carbohydrates like pasta. It would make me really sleepy. I became pre-diabetic, even though I was a triathlete and worked out all the time. And I also had very limited tools for my patients, like medicines was the only thing I could prescribe, or maybe physical therapy, or tell someone to go and, don't stress so much, go on vacation. There was very little to tell people, exercise a little bit, but I didn't really understand what all that meant. And then there was a lot of illness in my family, cancers, different thyroid issues, diabetes, hypertension, and I just didn't want that to be my future. And then I found the world of epigenetics, which my last year's talk was about the how we can use lifestyle factors to change our genes. So this will discuss a little bit about that too, but the point is we are in so much more control of our destiny, of our health, and the knowledge we have on aging is exploding. So this is a very exciting talk for me because it's just very empowering for people to know what they actually can do. There's this concept of health span versus lifespan. And health span is the quality of life that you have, not just how long am I living, but what is the quality of my life? And I want to get people to, when I ask people if they're feeling well, are you feeling healthy? People usually say, yes, I'm fine. I feel healthy, because they don't have things that are like hypertension or diabetes, or, but if you have anything that's kind of like, I don't know why I'm gaining weight, or why am I so tired all the time? Why do I have brain fog? People don't really understand that that is a symptom of being healthy. So when people have illness, diagnosable illness, I kind of put them on a spectrum from in the negative numbers, which is like, -1, -2. And then they get to zero, which means that everything is managed. I'm not actively having high blood pressure. I have that controlled. I'm not actively having diabetes out of control because I'm on meds for it. They consider that being at zero. And so what I want to do is get people to not only age better and improve their health span, but also get them to thrive. And so thriving means you're getting into the positive numbers. It doesn't mean you don't have illness. It just means that the way you feel and the joy you have and the kind of motivation you have to take on things and move and run around with your grandkids and not go out to social events, those are things that help us thrive. And so aging well means keeping independence. So structurally that you can leave when you want, you can, that you're able to ambulate, that you're not at a fall risk. It's reducing time of being disabled, because the studies now show that a lot of us in our last 10 years of our life are spending a lot of times either with disabilities or significantly sick or in the hospital for the last, significant amount of years before we die. And so we want to reduce that time to a very active, independent life and full of joy. And so improving that is the health span. We also want to keep our individual organs healthy, like our liver and our kidney, and our brain. We want our structure to be strong, and we also want our mind and body to be connected, have control of all of our senses. So the sense of sight and the sense of hearing really are very, very important to keep those in order to keep our mood and our activity level strong. So we want to get people to the positive side, and we want to create resilience. That is the key take-home message from this entire lecture, is how do we become resilient to the things that are associated with aging, and what interventions do this? Well, let's get back to things in our control. But first, I'm going to ask everyone to think about, why did you come into this lecture? What is your why? What are you thinking about? Are you worried about you? Are you worried about your mom? Are you worried about a neighbor? What is the reason that you're interested in learning about this? I mean, it seems pretty obvious, but the reason I'm asking is because at the end of all of the things we talk about, I want it to be actionable. I want you to be able to take home a thing that you're going to try or do or maybe change after you hear this talk, maybe on Monday. But we want to be able to do something actionable and not just absorb it. And sometimes you have to hear things many times in order to do that, but just think about, what is your why? Just the concern that we all have as physicians and in the world at this point, and why lifestyle is so critical, is because chronic illness is going through the roof, especially in America. We have a lot more neurodegenerative illness. It's a very scary kind of a neurodegenerative, means the brain, the spinal cord, our nerves. It's associated with Parkinson's, dementia, memory loss, things that affect our mind, our clarity, our cognition, and our movement. And so that is expected to be 12 million people in 2050. So all of these numbers are exponentially increasing. Metabolic issues like diabetes and obesity are increasing as well. 1 out of 3 adults are expected to have a metabolic issue, and that's 33% of our adult population, and it's now affecting children as well. So more than 66% of our population is currently overweight or obese. So it's actually normal now. If you think about what normal means, is to be overweight or obese. That doesn't mean it's healthy, it just is more normal. And so that is a very big concern, because we know that increased fat around the midsection is a very high risk for chronic inflammation and chronic illness. Cardiovascular disease is expected to be 61% of adults in 2050. That is greater than 1 out of 2 people to have heart disease. And 40 to 50% of people right now there's a cancer risk of 40 to 50%, lifetime risk of cancers. That is an insanely high number. And autoimmune illness also affects about 50 million Americans. So these are very high numbers, and we really need solutions that are going to address the core cause, which is inflammation. And inflammation is an itis. It's a result of our immune system being trying to protect us, and sometimes it gets out of control. And it's made up by the immune system. These are cells that target the threats, our enemies, our damaged cells, and it's a 7 to 80% located in our gut. So cells that affect the potential for us to create inflammation in our body, to fight off inflammation from our surroundings, to keep us alive, is focused around the gut. So this is why I kind of obsess about the parasympathetic system, the rest and digest system, because the gut is very important. So don't ever let anyone tell you that you don't have control. If you get a diagnosis of something and you say, what is it that I can do? Oftentimes, Johns Hopkins is in my backyard. I practice in Maryland. A lot of my patients come from very, very, very bright institutions that are telling them, sorry, you have X, but don't worry about it. There's really nothing else you can do about it. Or, what you eat doesn't matter. So I want you to never let anyone let you, convince you of that, because inflammation is definitely controllable to some extent. Most people think about inflammation, especially on the skin, when you can see redness, you can see heat, you can see swelling, you have pain, you itch, some things are hot. And so that is a sign of external inflammation. And it is suggestive that the reason we have it is that our immune system is not balanced. And there are 4 different ways of our immune kind of balanced states of our immune system. And one is having an immune system that's strong, that understands who the bad guys are, that can fight the viruses and the bacteria quickly. You see it, you get over it, and you're good. There's another type of low function immune system, and this is a balance between 2 separate sets called Th1 and Th2. It's not so important to know what those are, but because that's a completely other lecture. But a low functioning Th1 looks like I get sick a lot. I'm getting a lot of bacterial infections. I keep getting strep throat. When I get sick, I stay sick for a very long time. So it's not just about infections, it's also the part of our immune system that screens us for cancers. So a low functioning immune system is dangerous for many types of inflammation, including chronic infections, but also for things like cancer. When the Th1 is unbalanced, the Th2 system tends to be a little bit overactive, and those things are our tolerance for regular stuff in the environment tends to go down. So things that we are used to, like pollen, for example, or dust, or things that are not threatening per se, our tolerance for it goes down, and we start to get things like asthma, allergies, eczema. So that's another sign of a dysfunctional immune system. And the third way immune system can get dysfunctional is that the autoimmune type of it. So it's like our body starts to attack itself. Our thyroid looks like the enemy. Our joints look like the enemy, and we start to get things like rheumatoid arthritis or autoimmune thyroiditis. And this is another balance system. That's why some people are confusing how can I be so sensitive to, so strong about protecting myself from viruses, yet I have an autoimmune condition? You know, what is wrong with my immune system? And the same person can have all three dysfunctions, and one person can have just one dysfunction. So the immune system is very complicated, but it can cause multiple itises in the body. An itis on the skin, like we talked about, looks like a redness, a heat. It's easy to see a scab forms. We know that there's inflammation, and inflammation is not always bad. It protects us. So if we get a scratch or a wound, we need inflammation and the cytokines and the cells of our immune system to fight and get rid of the infection and then form a scab and heal our skin. So inflammation is not all bad. It's when it's uncontrolled that's the problem. So in the brain, when we have an itis of the brain, it can look like memory loss and anxiety and depression, so the mood-related disorders. In the lung, it can look like bronchitis and pneumonia, sinus infections in the sinus, eczema, rashes, psoriasis, hair loss can all be itises of the skin. And of course, in our gut, we have tons of gut issues, heartburn, indigestion, IBS, IBD, diarrhea. So these are all signs that there's some inflammation having an issue. And many, many things in our environment are immune disruptors. So our immune system is very, very resilient. It's really wants to heal itself, but there's constant disruptors out there. Some of it's in our control and some of it's not in our control. So we want to talk about today what is in our control, because we can get infections. We all have, you know, seen what COVID is, or like the threat of flu every season, RSV. We have all these viruses that are out, all these infections. Allergens are out there that are their immune disruptors. And again, our tolerance to allergens can change as we age. Toxins in our water, in our air, in our food, our pesticides. You know, there's so many disruptors out there, chemicals on our fabrics, our clothes, things that are out there that just really disrupt the immune system. But those may or may not be in our control. Sure, we can choose to get our clothes dry cleaned or not, but my point is that there are definitely things like stress, huge immune disruptor, as well as some lifestyle choices. And what we want to do today is focus on what is in my control. What is it that I can do today? And again, there's the toxins that are out there. We can choose to, you know, eat foods that are organic, you know, drink purified waters, avoid pesticide foods, have, you know, meats that have been grass-fed, and better tolerated organic type of raised farming, things like that. Our air we can purify. In our skincare, we can choose to pick ones that are organic. We can also do less EMF disruptors. EMFs are coming up as a huge disruptor of the immune system. We could turn off our routers at night. We can shut off our Wi-Fi. We can put the phone away from us. You know, there are things that we can do regularly to affect our immune system. But first, I want you to understand what your body is telling you, because you don't just wake up one day with rheumatoid arthritis. You don't just wake up one day with heart disease. It is a constant kind of signaling that you have from your body that is telling you these different symptoms. For example, for me, it was fatigue, along with being pre-diabetic, along with not being able to eat carbohydrates. So, you can start talking about, like, listen to your body. You can say, well, I eat very well. Why is my body, why can't I lose weight? Not being able to lose weight is an inflammatory state. It is a symptom of something not working efficiently. I'm so tired all the time. Is that just aging? What is that about? You don't get significantly tired by the time that you're 40. So I get that all the time from my patients who come in. They're like, oh, my doctor, I went to the other doctor and they said, what do you want? Why, well, you're so tired because you're 40 now, you're 45 now. Well, it's the number doesn't matter. It's always a symptom of there's something out of balance. Why does my body ache so much? Arthritis is not a guarantee. It's not a destiny. It's not something we need to accept. It's your body's not supposed to ache just because we're getting older. I want to be able to run around with my kids, but I can't because it's just so much effort. I never feel like doing anything fun anymore. So that sense of apathy, that sense of I don't want to get up and do anything, that is also a symptom of something. Your hair thinning, your skin changing, all of these. Sure, you with aging, we get wrinkles, we get different issues that come up, but it shouldn't happen overnight. And then the worst one is, my labs are all normal, so I must be okay. But why do I still feel so bad? So these are some things that you just want to start thinking about if you're feeling it. We are in a very stressful time right now. We have more chronic illness than ever. We have lots of fears around. We have a lot of political tension and world events and environmental concerns and climate issues. And so there's a lot going on that is very stressful, that is maybe not in our control, but it is something that makes us change our immune system. So the usual coping method we have is from my favorite bakery. Stressed spelled is dessert spelled backwards. And usually what we do when we feel stress is we want to have some sugar, we want to have some potato chips, we talk about comfort food, we talk about sweets, we talk about a glass of wine. Those are our usual techniques. And I'm not saying you should never do them, but we want to find stress coping techniques that are also going to be favorable for aging and maintaining health and lifespan and health span. So that is part of this journey. So the journey is driven by that stress in some manifestation. In the 31 years I've been practicing internal medicine, stress, mental stress has played a significant role in the manifestation of symptoms and illness in my patients. So I have come to recognize and respect the role of stress. It is not always what you add. It's not, hey, this is your symptom, take a pill. It usually does not come in a pill. But, it's important to know that it's not something you have to take or do. Sometimes it's what you have to change or give up. So, these are some principles that I found to be outside of medical school to be very aha moments for me. So before I talk about what we can do, I just want to spend a little time talking about how we break down. There's a system in our body called the autonomic nervous system, which is inclusive of a nervous system that is out of our control. So it's our voluntary nervous system is I'm going to pick up this cup. That's voluntary. Autonomic means it's involuntary. It works on the sympathetic and the parasympathetic. And these two systems are kind of never allowed to be active at the same time. So the sympathetic system is fight or flight. It's in charge of getting us out of danger. And the other one is after we get out of danger, we want to rest, digest, and heal. So these are protective for us, running from a tiger, getting out of a house that's on fire, helping our child who's fallen from some sort of equipment in the playground. Those are things we have to react, we have to move, we have to get there. That's our nervous system, our adrenaline's got to kick in. So neither one is bad or good, and the system is there to protect us and keep us alive. So the sympathetic system is notable for having adrenaline or our fight or flight. It needs to get our heart pumping and get blood flow to our muscles, and it's anti-inflammatory. So if you were thinking about, running away from something dangerous to us, you don't want to have to worry about your back pain. I mean, we've all seen these kind of photos or images of women lifting cars up. Somehow they get the strength to lift the car up from under their, getting some of their child freed. You get speed, you're vigilant, your eyes dilate, you want to be alert and active and to preserve ourselves. So that is a normal response. It's just that when it's on all the time, that becomes a problem. The parasympathetic system is there as with the acetylcholine is there to kind of rebuild us and heal and keep us calm and help us to refortify us. It's kind of like the charging of your cell phone battery. So it is innervated by the vagus nerve, which is a super important nerve, and it's a very, very important thing to learn how to support our vagus nerve. It's involved with the rest and digest. It's in charge of our fertility. It's in charge of our sleep, quality and quantity. So the parasympathetic system is really, really important. When we are on sympathetic overdrive, it is again not the problem is that is it's not a problem to be having a sympathetic issue happening. It's when we're persistently activating it. We are thinking about fear, we are afraid, we're anxious, we have a pain, we have you're getting angry about sitting in traffic, you don't like the situation with your boss or your home life. These are things that keep us activating our sympathetic system, and we are now, a lot of us are in this sympathetic overdrive, meaning our sympathetic system's always on and our parasympathetic system is too low. And this is where I think all the symptoms are. So mostly what I do at my practice is just try to raise that parasympathetic system so that the symptoms, the gap between these two, is smaller. And having the charge rate of your battery, the vagus nerve charge, your parasympathetic coming up, starts to eliminate a lot of the symptom complex, because when you have persistently high level of cortisol, you will start to mobilize your stress response more. You will start to elevate your blood pressure. You will start to have inactivity with your immune system, because cortisol is very important for the immune system. It is anti-inflammatory, but it can turn into a dysfunctional immune system if we keep it active all the time. Cortisol is also in charge of our sugar. So if we constantly are asking our cortisol to be high, then we are constantly turning that into hyperglycemia, which, as we know, can turn into diabetes if left unchecked. Many of my patients who have diabetes issues and issues surrounding prediabetes, including myself, the reason of the elevated cortisol is a lot of times overlooked as how is my stress contributing to my sugar? How is my lack of sleep contributing to my sugar? And so the same thing goes for the blood pressure issue and the heart rate issue. Persistently elevated blood pressure gets us moving, gets our blood flow to our organs. But if it stays high, then we're going to have an issue with hypertension. Same thing with the heart rate. When it stays high, we're going to have arrhythmias. So these are ways that an overactive system can kind of cause problems down the road in diagnoses. So a short-term stressor enhances the immune system. Like exercise is actually a stressor for our body. And that's a great way to enhance your immune system. It actually helps prevent infections and get us over infections when we exercise regularly. It helps different parts of our immune system, like the macrophages. These are white blood cells. It's been shown to help that Th1, Th2 system. It helps with wound healing. Accepting vaccines, are the way we accept vaccines into our body and actually mount the response we need to respond is based on the short-term stress response, fighting infections, fighting cancers, and it can build us. So the short-term stressors are not bad. Long-term stressors start to hinder the immune balance, decrease the number of cells in the immune system, and decreases our immune protection. So that causes inflammation. That causes increase in autoimmune issues, increase in allergies, increases in all of those chronic illnesses. So it is stress driven. And also one big thing is that if I said to you that, one of the biggest things you can do is make lifestyle choices for self-care, lack of stress leads to, excessive stress leads to low self-care. So we tend to do less good things for ourselves when we are overly stressed. I am also a culprit of that. I know that I'm supposed to eat the way I'm supposed to eat. I know I'm supposed to prioritize sleep, but when I'm very, very stressed out, that stuff goes out the window. So excessive fear, excessive worry tend to take over. Our sympathetic drive takes over. We can't sleep. We tend to not want to move because we're so tired. We're grumpy, so we don't want to talk to people. Creates more loneliness and just isolation. We get more sugar cravings. We get increased intake of caffeine and alcohol. Overwhelmingly lowers our immune system and it makes us less resilient. Our goal for this lecture is also to create resilience. How do we age better? How do we create resilience to all the things that are in our environment that we cannot control? How do I do that? So I'll just give you a little personal story. So this is my car. When I found out, I was driving from the hospital. This was in COVID, where as a physician in a hospital, I could not see my mom, who was admitted for what we thought was at that point a pancreatic cancer onset. She had a mass, she was jaundiced, and the GI doctor was going to come and talk to her they had called me and said, there's a mass in her pancreas, and and they were going to tell her, but she was by herself because it was COVID, and I was on the phone while I was driving from the hospital, which is a few miles from my house, and with the nurse that's saying, pleading, can I please come and stay with my mom because I don't want her to get the news by herself. I want to be there. And I was pleading with her. In the meantime, my tire falls off and it starts rolling. Of course, I just keep driving, overly stressed out. I'm panicked about my mom, felt very helpless. And I just kept driving until someone came up next to me saying, you need to stop your car. You don't have a tire. So a normal functioning human being, fairly, moderately intelligent, didn't even know what to do when my tire fell off. So this was me in a time of stress. This is that kind of like deer caught in headlights moment. But this is very, very normal for us doing this all day. We tend to make not great choices because we're stressed out. So remember that your symptoms are not necessarily illnesses. You do not have to wait for a diagnosis. Your body is talking to you every day. It's kind of like that car light, that something's going on. The flashing light that says your engine light is something's wrong with your engine. If you just duct tape that and you said, I'm just going to keep driving, like I did, I just kept driving without the tire, there is something really bad that's going to happen down the road, right? So you're not going to be able to get through that if you don't pay attention. The sooner we get to the problem, the better it is. So fatigue is a huge, huge sign that something's off of balance. It's not specific to any one thing, but it's a very, very common symptom of something off balance. Poor digestion, stool changes. We'll talk about that in a little bit. Acne, skin changes, weight gain is also a problem. When you can't lose weight, even though you're trying all the right things, that's something is out of balance. I can't concentrate as well. My memory's not as good. Lower mood, achiness, irregular menstrual cycles. And there's so many symptoms. I couldn't write them all, but they are also obviously as we age, we are going to have different symptoms because as we age, our immune function goes down. And we can do things to maintain it, but as we age, we do have the incidence of colds and not recovering as well. We get more infections, which is why some of those vaccine recommendations are, at 50, at 60, based on your chronic illness. When we have chronic inflammation in our body is not, it's like not able to focus on the bad guy. So, pneumococcal vaccine, shingles vaccine, these were accelerated because of the fact that, and recommended at different ages, because as we age, our immune system goes down. As we are stressed, our immune system goes down. So rates of cancer also go up with aging. Heart disease, chronic inflammation in our heart and our blood vessels, they go up as we age. Type 2 diabetes incidence, insulin resistance, weight gain, all of these things are associated with aging, but you shouldn't basically sit there and say, I'm just going to accept it because I'm getting older. Joint disturbance is definitely higher as we age. Memory loss, dementia, and decrease in performance. Like we're not as sharp, we can't learn as fast, we are not able to complete tasks as fast. But again, it should not be accepted as normal. We should be able to understand that we do have a role in that process. And in fact, now in the anti-aging community, the longevity community, it is actually thought that as we get older, we actually can get better. And so there's a lot of information coming out on how we can optimize our body so that just like wine, we actually do better as we age. And that's a fantastic, hopeful way to look at it. But this lecture is going to focus more on, just basically doing the things that we can do to kind of balance our bodies and age better and create more resilience. So a lot of this is discussed in my book, Body on Balance. Our lifestyle factors do matter. We have stressors that sometimes are not in our control. We have our resources, which are in our control, and I'm going to add to some of these as we talk today. Exercise and yoga and things that are in our control for daily practice, restorative sleep, plant-based diet, plant-forward diet. And so when we keep those things in balance, inflammation goes down. And inflammation in your body, again, is itis. It's body on fire. It's an inflammation. And when we keep things unchecked, when we have symptoms, I'm tired, I gain weight, I'm constantly stressed out, I'm very fearful, I'm angry, I'm not sleeping. These are things that eventually can cause disease states. So symptoms unchecked can lead to a diagnosis, but you did not wake up one day with this onset. It has been all of these things have been kind of accruing over years sometimes. So how do we protect ourselves? Okay, so we work on that parasympathetic system, the balanced body approach, where we're trying to create some balance and do things that we have control over. It improves resilience. And with that, we are going to age better. So let's look at the digest part of rest and digest. Remember, parasympathetic system, vagal tone, right? We have sympathetic drive, we have parasympathetic. In that parasympathetic, it's rest and digest. We're going to start with the digest part. Why? Because 80% of our immune system, those cells that make the itises, are in the gut. And that's once because the microbiome, this is the genes that come from our bugs. And I'm sure people know what the word microbiome is. You heard it all the time. It's like exploding in literature. It's basically these gut bugs that we have that are there. There's hundreds and trillions of them. And so these are there to make our vitamins. They help our immune system. They shut on and off genes. So you could be predisposed to having rheumatoid arthritis. You get a vaccine or you have a high stressor and then you get rheumatoid arthritis. There's usually a genetic predisposition, but you can turn those genes off based on these lifestyle choices. So they are directly in control of turning on and off immune cells that lead to inflammation. They create our neurotransmitters, which are the cells, which are the chemicals that communicate with our brain to help our mood, help our memory, help our motivation. So things like dopamine and serotonin are very, very much associated with gut-brain axis. And so, we have meds for these. We have Wellbutrin and ADHD meds, but they're related to some of these transmitter imbalances that we can do a lot with if we just work on gut. The microbiome also creates our vitamins, our minerals in our body. It also absorbs nutrients and it metabolizes and creates hormones for us as well. One of the biggest things it does is it removes toxins. How? Through bowel movements. And this is an extremely important part because toxin exposure is becoming an overwhelming problem, and we need ways to eliminate toxins. And so the gut is a huge way. So is urine. We need to make sure that we're drinking purified waters, and we urinate regularly, and the urine is a light color and we're drinking enough water, 8 to 10 glasses maybe, so that we can start to get these toxins out of our body. Sweat is another way. And the fourth big way we can remove toxins is liver. Supporting the liver through nutrients, through a well-balanced diet can also help a lot. So what does a well-balanced diet look like? A whole food, plant-based or plant-forward diet is very, very important. I stick to kind of two things that I tell people that they really must do in order to maintain that gut microbiome is fiber. You want to get between, at least 30 to 40 grams a day, at least. It's a tall order, and you can do that through different plants. And so when you start to think about plants and you start to think about the ability to add some of these grains and legumes, and of course, some people are sensitive to certain things, and I understand that. So I'm just talking in broad strokes. Certain vegetables are intolerant for some people, like nightshades and people with osteoarthritis, people who have sensitivities to grains, is oftentimes a problem with the gut itself, and not that they have celiac disease, but the gut is unbalanced. So things like legumes, intolerance to digestion to legumes and beans may be a function of a dysfunctional bacteria in the gut microbiome, or a bad bug, a bad something that's there that shouldn't be there, poor digestive system. Leafy greens, and you can add things like nuts and seeds also, but these are all sources of fiber, and they are foundational in almost any food plan that you want to try to do. And so it's not always what you add, right? So you can eat all of these servings, but if you follow it with a glass of soda and French fries and processed foods, your body is not going to be as healthy as if you avoided certain things that are disruptors of the immune system and can cause inflammation. Things that are high in sugar, high fructose corn syrup, for example, apple juices, things that are juices are concentrated. Even smoothies, which are mostly fruit, can be problematic in some people. I always like people to have, 3/4 of their smoothies to be greens and maybe 1/4 of it to be a fruit, because of the fact that you can actually increase insulin resistance and fatty liver by having 100% fruit smoothies, even though that's a good food. High animal products, the quality of animal products matter. Just having a high animal diet can create an acidic environment, and our bodies tend to do better in alkaline environments where we have more plants. So if you're just plant forward, I'm also very happy about that. So, quality of the products, everything that you eat, just make sure if you could try to see if it's the best quality of that food. For example, an apple or an applesauce. This is a processed version of the apple, so the actual apple would be better. Does everyone have to eat organic? No, but make sure you wash your fruits and vegetables really well because the pesticide count is very high on certain ones of them. And that you can find on the Clean 15 and the Dirty Dozen, which is published every year in environmentalworkinggroup.org. And also things that come in packages, processed foods, highly processed food is a big problem. Things that are in packages, boxes, um, small packages like protein bars and granola bars, as opposed to like, things that you make granola, whole granola by yourself. Uh, Things like potato chips, soups that are in a can. These are oftentimes high in salt and high in chemicals, and you can start reading labels, which is a great way to understand what your body's taking. If that label is this big, for example, a bread from the bakery usually has two or three ingredients. It has sugar, flour, and maybe some B vitamins. It has some yeast in there, maybe four things on there. But if you look at the label on the bread aisle, it's about this big and it has lots of chemicals, names. I don't even understand them. So that's a version of a processed food versus high preservative processed food. So we want to be able to try to get the whole food as much as possible. For example, a grain that has been unshaved will be a little bit harder and more brown than something that's shaved and very soft. So leave a bread outside. If it doesn't mold in 3 days, that means it's got a lot of preservatives in there, probably junk that shouldn't be in there. So, there's a joke about, throw a Twinkie in the back of your car and it'll still be a Twinkie 20 years later. And that's a little scary because there's a lot of junk in there that keeps it soft and mushy and the way that Twinkies are supposed to be. Anyway, so the diversity of the immune system matters. We want to eat different types of food because our microbiome, the more diverse it is, the better we age. The more diverse it is, the more resilient we are. The more diverse it is, the less chronic illness we get. So it is really important to kind of look at your foods and eat different. If shopping once a week, fine. Just maybe one time get a kiwi, get a dragon fruit once, maybe just don't get the bananas all the time or the apples. Start diversifying your food, start diversifying your seeds, your nuts, your greens. Eat differently, eat the rainbow, eat seasonally if you can. These are all ways to kind of decrease immune dysfunction within the gut. When you eat seasonally, we are getting things that are fresh. And if you can do like a farm to table type of thing where you're part of CSAs or things like that, that food is coming straight from the farm to you versus sitting on a belt or sitting under radiation in an airport or sitting in a box for a long time. So the fresher the food, the more seasonal it is, the better it is on our bodies. So alkalinize and eating calmly is really important. If you're we've all been culprits to this. We're eating in between, meetings or patients and in our car, we're eating while we're driving. This is the culture we have. It's just everything's go, go, go all the time. Our parasympathetic system, when we eat fast, when we eat quickly, it tells me that I'm running from a tiger. So when we eat urgently, panicked, like, let me just get this in so I can get going, that is activating our sympathetic system, which means that the parasympathetic system, which is in charge of our rest and digest, is down. So your body's like not ready to digest. So your juices in your mouth aren't being generated. Your acid in your stomach's not being generated. Your pancreas isn't releasing these enzymes because it's like, I need to run from this tiger. I can't stop to eat right now. And this is one of the biggest reasons people have heartburn and indigestion and bloating because of the way we eat. So I'm not saying you have to be a monk or you have to sit in a corner and not talk to anyone, but try to create a calm mind, do some deep breaths. Even gargling, for example, can start to create some juices in our gut. before we eat. And the calmer we are, the more pleasant it is, the slower we eat, the more we kind of savor our food, the better the digestion. You can add things that are in liquid form too that increase polyphenol or the phytonutrients or these nutrients that are in different types of foods, like different types of teas, herbal teas, green tea. Adding fermented foods. These are foods that have bacteria in them, like probiotics. These are foods that will grow that diversity. And drinking enough water, obviously, is very important for all our cells because our mitochondria, which are the cells of our energy producers, need water. Our entire body needs water to work efficiently. So water, water, water. Please stay away from juices and sodas and empty calories. So water's great. And add a lemon in there. You can do some fruit infused water. And spices are a fantastic way to get in antioxidants and anti-inflammatory. These are my favorite spices. I have entire talks on spices because it's endless and it's amazing and I love them. But you can throw them in food, you can throw them in water, you can throw them in teas, you can throw them in different types of beverages too. So in salads, there's a lot to do with spices. So that's another way to add color, but it's also a way to diversify your food. So I tell my patients to try to get 30 different plants in a week. That doesn't mean you only have to eat plants, but 30 different plants, and spices count. So if you had ginger in your tea, or if you had garlic in your pasta, and rosemary in your pasta, or basil in something, you got cinnamon in your coffee, and you added cloves in something, you are able to diversify, and those all count as one. So you can do a lot. And also, when you eat foods, for example, raw onions and cooked onions are two different foods because they do different things to our body. So they count as two different items. So there's an easy way, especially if you layer things like the kava approach, you can get easily 30 in a week. Um, and remember, it's not only what you eat or what you're not eating, it's also when you eat. So there's a lot of data coming out on fasting and the role of intermittent fasting, which is time restricted feeds is one way to fast. It seems to be the easiest way for people to start the concept of fasting. You're resting your gut microbiome, you're resting your liver. Again, those are really big places to detox. They're always working because we have so many things going on all the time, especially your liver. Your liver is digesting, I mean, it's detoxing not only what is in our air, but also our hormones, also our cortisol, also our meds, our supplements, our foods. So it is working constantly. And so when we give gaps between meals, for example, 12 hours, I think 12 hours is pretty reasonable for most people to do, meaning your last meal's at 7 and your first meal's at 7 p.m. is your dinner and your first meal's at 7 a.m. That's a 12-hour fast that you've had. And you can eat, some people eat in 8 hours windows, 6 hour windows. It really depends. There's no one perfect concept for everyone. I think it's important for people to wear the continuous glucose monitor sometimes to see what your body likes. You can tell sometimes how your energy is, how your body's feeling. You can tell by your workouts. You can tell if your performance is changing based on if you have enough food or not. But most people can do about 12 hours. There's also periodic fasting, meaning you're skipping a couple of days in a row. And sometimes 36 hours starts to increase when we haven't eaten for 36 hours. It starts to help our hormones. It starts to help some of our adaptive resilience genes. It starts to help our growth hormone specifically. So you can start to do that, and our immune system gets better when we fast, say, for 36 hours. And then there's ways to do water fast for 5 days or fasting mimicking diets with Prolon, which is a company from L Nutra that makes a kit called Prolon, which I do with my patients at least once or twice a year, where we're fasting for 5 days. And Prolon, actually, you're eating too, because they give you food over 5 days, and you can only eat what's in the box. It's soups and it's olives and it's crackers, but it's slightly not ideal, but it is a really good way to get an immune reset, because if you don't eat between 3 days, 3 and 4, your new stem cells, these are baby white cells. These are pure white cells that are not pre-diabetic. They're not autoimmune. They're not precancerous. They're coming into your body. So we're creating stem cells when we're fasting for 5 days. And we're also we're getting rid of the inefficient cells. So, and their website is a wonderful place to look because you can see that your entire immune system, not entire, a significant portion of your immune system can change from unhealthy cells to cells that are there. Now, I don't think it happens overnight. You have to do this repeatedly over years sometimes. And when you start, you may want to do it 2 or 3 times in a row, once a month, maybe up to 4 times. And then you can do it periodically. And what I have found in my patients is people say their pain is better, their arthritis pain, they're able to, yes, it is weight loss sometimes, but that's not the reason you do it. You do it for the stem cells reset, the immune protection, the resilience genes come on. It helps with sugar control, lipid control, waist circumference. So there's a lot of benefits with the 5 day fast, or water fast for 5 days. And I have some more information on my website about water fast and Prolon if anyone's interested. But there's fasting is a wonderful tool for helping us age better. And then one of the other thing about food is that loneliness is becoming an epidemic. So especially through COVID and our fears, and as we age, and for people especially who are chronically unwell, they don't want to leave their home, they don't get sunlight, they're isolated, and it starts to breed. So there's chronic illness, people who have chronic illness tend to be lonely, but loneliness breeds chronic illness. So it's a two-way street. But what food does sometimes, the other role of food and diversity of food is it brings people together. It gives purpose when you're making food, especially if you're making food for someone else. And it adds color and variety, and it adds, some happiness when you start to look at different colors, different seasonal things, potluck concept, it helps that other big factor, which is one of the causes of chronic illness is loneliness, and it kind of offsets some of that too. Um, so now I'm going to get to the rest part. So the rest of the rest and digest of the parasympathetic system is one part of it is sleep. Can't say enough about sleep. It is something that I have obsessed about, and usually I start with this aspect with most of my patients, because if we're not sleeping, it is affecting everything. It's affecting the way we remember things. It is affecting our blood pressure, our heart rate, our sugar control, our hormones. And one of the biggest things it does is it helps us detoxify. So it helps those toxins, which are in our mind, remember, neurodegenerative diseases are going up. A big part of that are toxin related illness, whether it's memory loss or Parkinson's, into the brain. And we want to detox these things out of our body. Where does that happen? That happens in our sleep. So if we do not sleep enough, we're not detoxifying our brain, and we are holding on to those toxins, and it is very dangerous. So we want to be able to promote sleep. We want to lower inflammation. We will lower cortisol. Sleep is a very big tool that we can work on. Um, if you imagine how much detoxification is, people are like, oh, I got 6 hours, what's the big deal? You're supposed to get between 7 and 9. So that delta, it's not just how many hours, it's also about the quality of sleep. But if we're not getting enough time in sustained sleep, we're not getting to that detox. And if we're losing even an hour or two per day, we're losing 14 hours or 7 hours per week of detoxification, which will accumulate over time. So when we think about, oh, it's just 30 minutes or it's just an hour, you're talking about big picture. That is a lot of hours of potential detoxification that you're not getting. So this is another reason why I really obsess about sleep and sleep promotion. And sleep disruptions are not just falling asleep or staying asleep. There's also fragmented sleep. There's REM disorders. People aren't getting significant stable sleep. They're not getting into deep sleep. Sometimes you know this because you're waking up tired, or your partner says you're snoring, or you sound like you're choking. But there's other problems with sleep that we just never know about. And so this happened to me. I didn't even know I had sleep issues until I wore a ring that watched my sleep. And I found I had a lot of sleep disorders, which were related to fragmented sleep and for many reasons. But there's different things we learn about these devices. So uh, it is not just about waking up tired, it's also about trying to quantify it. And I do encourage my patients to wear devices, even if it's short term, just to see what their sleep patterns are, so that the interventions we make, whether it's hormones or melatonin or magnesium, we can see if it's making a difference on their sleep quality. It also is directly related to weight. So I have a weight loss program in my clinic. And so one of the biggest issues I also talk about in my weight loss program is sleep, because if you are not sleeping properly, your hunger hormones and your hunger cues change. And so you are going to be hungrier. We know this, right? When was the last time you were sleep deprived and you wanted kale? Like that just doesn't happen. We crave sugar, we crave salt, we crave comfort food. And it's not always wrong. It's just that it's a symptom. It's a sign that your body's saying something is off. And when we don't sleep, we increase our cortisol. Remember, anything that increases your cortisol long term sets off that sympathetic overdrive, right? So we want to be able to understand what physiologically is happening in our body. Also, when we're awake longer, we have more time to eat. I catch myself sometimes around 10:30. All of a sudden I'm hungry. I'm not hungry. I'm tired. I just need to go to bed. So in my mind, I have to tell myself, you're not hungry. You're just tired. Go to sleep. So these are cues that our body's telling us something is off. And oftentimes it's just we need to rest. So, these are the concepts that are related to weight management when it comes to sleep. So when we are having, it's a good time to kind of segue into the obesity, visceral fat issue, because having sleep disorders, having excessive cortisol for whatever reason, can cause deposition of fat in the midsection. And that fat is called visceral fat when it is not subcutaneous fat. Subcutaneous fat is the fat that you pinch. Visceral fat is around the organs. And we have scales now, like Omron is a company that makes a scale that you can use at home that kind of monitors this visceral fat. Should be under 10%. And so excess visceral fat shows up as sometimes as a high C-reactive protein, which is a marker of inflammation, but it doesn't always. And so you can use your BMI, but it's a guide, your body mass index, which is your height weight ratio, but it's not ideal. Actually checking your fat percentage would be better. Your muscle mass content would be better. Looking for insulin resistance would be better, and seeing hormone imbalance in the body. So looking at cortisols and sex hormones like testosterone and thyroid, and all of these hormones are imbalanced also when we have excess visceral fat. So remember, when we have this fat, and I have a lot of people come to my, mostly women, who are like, what is this fat about in the midsection? Sometimes it's hormonal, menopausal, sometimes it's high cortisol, sometimes it's high insulin, but it is a symptom of something off balance. So it's important to know that sleep plays a role in this as well. So prioritize your sleep. That's the first step. Do not, we have this kind of thought process, I'll sleep when I'm dead, kind of an attitude. And we wear it as a badge of armor, like, oh, I only went on 3 hours of sleep. I'm so functional. But it is not safe for us. It is dangerous for us. It is something that we have to start prioritizing. And like I said, I really do start with something like this when I see patients, because if we're not sleeping, we're not able to follow directions on food plans. We're not able to be as active as we want. We're not able to remember things as well. We're not motivated as much to do the right thing when we're not sleeping. So these are some ideas of removing notifications, trying to remove caffeine in the afternoon, electronics 1 or 2 hours before bed. You can use glasses. I'll pull mine out later to show you guys which blue green light blocker I use. You can try to maybe read things as a book and avoid LED lights, which are terrible for our sleep-wake cycle. Avoid them in the bedrooms, and decrease news feeds, because I find that they're like horror shows. You don't want to go to bed anxious and worried and fearful, which is what most of the news is about. Try to get some calm thoughts, calm minds, read a romance novel, read something mystery or something that's not going to be gruesome, because it really does help our quality of our sleep. Okay, exercise. So exercise is great. We all know this. Even when I was seeing 30 people a day, I'd tell people to exercise. Didn't really know much about the why, but we know that it's good for us. It helps with cardiovascular risk, helps with metabolism, but it helps our mood. It actually changes the way we respond to stress. It helps our memory. It raises something called BDNF. So it actually is wonderful for memory loss and preventing memory loss. It helps mobilize glucose and fat, and it helps your sleep. So the beauty of lifestyle is, unlike a drug, it's not this one pill, for example, is going to do one job usually, and maybe give you 3 side effects in the process. But one of these interventions will hit multiple areas. So your body is just on a positive spiral, as opposed to a drug that just usually does one thing. So when we see these, Having a better diet will help your mood. Having a better exercise program will help your sleep. Sleeping better will help you exercise. So all of these things are related. So that's why I said think about where you want to start. There's no perfect answer. There's no one answer. It's about where you think you want to begin. Because typically when you start doing one of these, all of the others seem to be really easy to kind of incorporate. As we age, one thing we want to do is maintain muscle mass. It is a big, big, big reason why we lose our independence, why we get diabetes. Most of glucose circulation is taken up in the muscles. So when we lose our muscle mass, which is called sarcopenia, which is muscle loss due to aging, just because we're aging. So it's these hormone changes that happen and we lose, even if I did everything the same, I slept the same, I woke up the same, I worked out the same, I ate the same, I'm going to lose muscle in a few years. So I have to work harder as I age to maintain my muscle mass and build. And so there are specific workouts that you do that are resistance based that will help muscle mass. Balance also we lose at 40. You know, almost everyone at risk for fractures is related to a fall. It's not a spontaneous fracture in most of the people that have osteoporotic fractures. It's because they fall. And so we want to maintain our balance and we want to maintain our independence, our structural independence, and we lose balance as we age. So we want to be proactive about working on things that incorporate balance, like yoga. Bone loss is another reason where we are becoming more fragile, and that's a function of also hormone changes like testosterone goes down, estrogen, progesterone goes down. These are hormones that affect bone density. So as we age and as we lose those hormones, we can start to have those issues. Lateral motion, the movement laterally is one of the things that also decreases. This is why things like Tai Chi and Qigong are also really helpful for maintenance, slow movements help our joints stay very moving, very nicely. So flexibility, rotational movement, things that help our bone density, resistance exercises, balance exercises, so exercise is not just about running on a treadmill. Um, one of the best ways we can age better is to maintain muscle mass, do exercises, add resistance. It wasn't something I ever enjoyed. I started to do it because I saw my bone density go down as my hormones started changing. I have to do it for my muscle mass and my glucose control. But you feel better when you have more muscle mass as well. You're stronger, you're more capable. And so flexibility, rotational exercises. So exercise is not just walking on a treadmill, running on a treadmill. It's a combination of all of these type of interventions. I know it sounds like a lot of work, but you don't have to work out for an hour every week. You can incorporate some of these on a regular basis. You can also just move more. So as we're, thinking about how do I add more movement, you can do things like treadmill desks, which are a little bit better than just a sit-stand desk. Sit-stand desk is not as great for our metabolism. Some studies have shown it's no different than sitting. I still think there's a lot of value to standing and moving in general. But treadmill desks sometimes on Zoom calls and things is very annoying for the person on the call. So it's not easy for everyone to do. Exercise ball, I have one in my office. I sit on a ball. Most of the time I'm standing and I'm walking around with my desk. You take the stairs, walk, park farther, walk more. You can do yoga between Zoom calls, just postures, down dog. You can do just move more, and squats and stretches. And there's a Dr. Zach Bush has a great 4-minute video that works on 16 different muscle groups. That is a fantastic way to increase energy and nitric oxide that I share with my patients all the time to add some of that. So, what are your goals? Maybe just start with walking 10 minutes, 5 minutes, get out in the sunshine. Increase your heart rate with 20 minutes of HIIT workouts, which is high intensity training. Cross train. You don't have to work out to the point where you want to vomit. That is not necessary. You can cross train, you can work out where your heart rate's at 70% of maximum. You can do a day of yoga, you can do a day of resistance, you can maybe add balance workouts and strengthening and Tai Chi and things like that to your workouts to kind of just like food, diversify it, change it up. Um, so sun salutations are one of my favorite things to do for just waking up the posterior part, our back of our body, they're just asleep all day because we don't use it. We don't use the muscles back there. So we start to change our posture, lung volumes start to go down because we're not working those muscles. We're also starting to get more back pain, things that are because one, we're just overwhelmingly supporting one side of our body. So we want to do things like stretches. I love Yoga with Adriene, which is a YouTube. It's free. You can look at this kind of map of what the sun salutations look like. You don't have to go to a yoga class or yoga studio, but just the concept of the forward fold, which is here, just wakes me up. Just doing that in between patients. Sometimes also I'll do the downward facing dog between patients. It just wakes me up because, when I'm sitting, I'm not activating any of these muscles. Okay. Dancing, also movement, also doing things like dance helps our brain. It helps, coordination of steps, learning things that are related to systems will activate parts of our brain, which keep our memory centers alive, our neural system alive. You can learn new things as we age. So movement and dance is a wonderful way. It's fun. It's also usually social. So maybe a dance class or something that don't be shy because everyone's a beginner sometime. And so these classes are very, very fun and enjoyable. And so you can do things like that, just run, dance with your grandkids or, anything that kind of gets you moving. Okay, so let me see how much time I have. So you lower your cortisol. Remember, sympathetic system is fight or flight, adrenaline, cortisol. The rest part of rest and digest. This is the parasympathetic rest and digest. It's not just about sleep. It's also about what we're thinking about all day long. You can do yoga till the cows come home, but if you are walking around anxious and fearful all day, that is not going to work. So we want to be able to control that mind-body connection. That mind-body connection is huge in preventing chronic illness. It has been really helpful, especially in the world of memory loss and neurodegenerative. It's also great for metabolic issues, blood pressure, diabetes control, because cortisol, remember, is unchecked cortisol can turn into hypertension, can turn into hyperglycemia, can turn into immune dysfunction, where you can get an autoimmune issue from it. So all of the disease states that we see that are exploding, if we can learn to control our cortisol, we can make a big dent in there. And these are some examples. I won't go into all of them because I think I'll run out of time. But simple things like 478 breath work. We have our breathing with us all the time. You don't need a device. Your phone doesn't have to be active. You don't have to charge your phone. You don't have to pay for an app. You breathe in for 4, you hold it for 7, and you exhale for 8. Simple. You do that 5 times in a row. And it just resets us. It just calms you down. People have told me, I can't believe how easy that was. But breath work is a huge benefit. It's free. Maybe you don't necessarily need to take a class. You can do YouTube videos, you can go online and learn. But it's fun to take a class. It's fun to learn different breathing techniques. You can use breath work to wake you up. You can use breath work to help you sleep. You can use breath work when you're fearful. You can use breath work when you're anxious. You can do tapping. You can do yoga. You can do so many tools that are there. Sounds, for example, headspace, binaural beats or sounds that calm our brain down. You can walk in nature. You can walk on the grass with your shoes off. There's so many ways to calm our cortisol down or, help the body and mind and body connect. Also, just find places of quiet. So remember, it's not just about sleep. What are you feeling as you walk around all day? Do you see your thoughts going crazy? We all have about 60,000 thoughts every day, and it's absolutely very similar to yesterday. They're not actually new thoughts. So we want to basically decrease, if we can, that mental chatter, create periods of quiet and create periods of calm. How do we do that? We can do it with those techniques of breath work or meditation or walking in nature or playing an instrument if you want, but things that just kind of bring you peace. Um, so these are also other examples of different mind-body techniques. Some of these you need appointments for, some of you don't. For these, there's very much value in anything that has to do with energy, like tapping, polyvagal exercises. There's books out there that teach you how to do that with eye movements. You can start invoking that vagal tone simply by looking in one direction for about a minute, and these are available on YouTube. But our vagus nerve, which is our 10th cranial nerve, rides with our nerves that innervate our eye. So you can activate the vagus nerve by eye movements. And so this is a very powerful tool also that makes you feel empowered when you are able to kind of help your digestion or your nausea by invoking those vagal exercises that help that nausea. You can make yourself feel better pretty quickly. Okay. So another big way we age better is our outlook on life, having more positive emotions, having more optimism. Why? Because it floods the brain when we have positive emotions like joy and awe versus fear and anger and resentment. These are negative emotions. There's more negative emotions than positive, but if we're working hard to maintain those positive emotions, our brain gets flooded with dopamine and serotonin, which help our mood and motivation and memory. And we can learn better, and we're more creative, and we can increase our storage for memory. So positive emotions, another thing that we can control. We can control what we feel in terms of our thoughts. We may have to work at it, but we are in control. It's very few things we are in control of. Our thoughts aren't always one of them, but we can learn to control our thoughts, and we can learn to create joy regardless of what's happening around us. And so this is an exercise. I'm not saying that this is easy. Along with my personal journey, this was one of the ways that I found very helpful in my kind of aging process for myself and my patients, is to create more optimism. And one way to start is this awesome TED Talk by Sean Aker, who talks about 5 easy things to do on a daily basis to change the way our mind starts to look at the world, to create more optimism, to look at what's good instead of what's always wrong or bad. And he's a Harvard professor, and he teaches all over the world. He's written books and he works with corporations. But this is one of the best TED Talks I've ever heard, and it's 15 minutes. It'll be a great 15 minutes if you listen to it. But he talks about just to be grateful. You think about gratitude. 3 things. When we start to become grateful, we actually start to change our mind and our brain into more looking for things that are actually going right. Our practice of gratitude has been shown to help with different illnesses like cardiovascular, like mood, like neurodegenerative, metabolic disorders. Just being grateful with having more gratitude can help us age better, can help decrease our chronic illness because it lowers the incidence of some of these chronic medical problems. Journaling something that's good, not what's going wrong, but what's good. Again, starts your brain to think about what's happening that's right today. Exercising, obviously, another great reason is to start to increase our positive emotions. Meditation, a practice of some sort of meditative practice, breathwork practice, something that's quieting us. And a random act of kindness has been shown to also be very helpful in just to do something just because, not for the thank you, not so that they can return the favor, but just pay it forward. Just random acts of kindness can really be helpful in our journey. And optimism, there's actually studies that show that it helps modulate that cortisol stress response. People choose healthier habits. They live 11 to 15% longer. That is a huge number. That's almost 8 years for someone who's 80 or plus, 8 to 10 years, 8 to 14 years, actually. So that is a long time. If you are practicing this kind of practice of doing things that increase our positive emotions and having a better outlook on life, we don't actually know why that happened, but these are some of the thoughts that those people also had lower chances of dying of strokes, heart disease, and cancer. They had stronger interpersonal relationships. Remember, I said about loneliness? That also is one of the reasons we age faster or worse, or we have this issue about chronic illness. So, having better relationships also helps us age better. And optimism was shown to improve our inflammatory markers like C reactive protein. It's incredible. The last thing I want to talk about, I just want to do a time check, okay, is another huge tool that I have recently come across. This is not in my book, but it is a huge tool for all of us based on the fact that we were built around the circadian rhythm of the sun rise and set. And so our organs are more optimally functioning at different times related to the sunrise and sunset. And my aha moment came when patterns in my patients' sugar control were significantly better in the summer than they were in the winter and fall. And I just always assumed this was related to, you're out more, you're exercising more, you're moving more. People tend to eat less bad food in the summer. There's less mood issues in the summer, so we're not doing comfort foods as much. So I just kind of always interpreted it that way. But then I learned about the pancreas actually has an optimal time where it works better. Pancreas is what the organ that releases insulin, and it works better during the day. So if you're going to have your fruit and you're going to have more carbs, do it during the day versus the night. So that same bowl of pasta that you might have at noon is going to be more taxing on your pancreas and your insulin and your sugar if you had it at 7 p.m. at night or 10 p.m. at night, which is worse. So we want to be eating and doing things because our organs are also want to go to sleep. They don't want to work at times they don't want to work. So this is a really powerful tool for health maintenance. It's very underused. It's not really discussed that much, but it's very practical. You can implement it. Most of us can implement it. And then there's a close association with metabolism and sleep. So we can actually, when we're trying to, go up with the sun and go down with the sun, our quality of our sleep improves, our metabolism gets better. So remember, all of these things cross react with one another. So one intervention can help multiple things in your life. So by following the circadian rhythm, you can help your sugar control, you can help your metabolism, you can help your weight by just being able to kind of follow these guidelines. So basically, it's, avoiding this blue green rays from light when the sun goes down. This is the role of the glasses that we have that block those light, but to also be able to eat before sunset. Um, and so simple concepts like that. It's not always easy. For me in the winter, it's very challenging to eat before sunset, but you do the best you can and you can it has made me go outside more because if our eyes see the changes of light from dawn to sunrise, and then watching sunsets, there is actually a physiologic reaction that happens in our body that benefits us when we watch a sunset. It's not just that it's pretty, it actually changes our biochemistry. And so, watching the times of changes of light during the day can really help our bodies and help our inflammation levels. So, avoiding LED lights. They emit a very high intense blue wavelength. I don't even know if you can buy anything that's not LED anymore. So maybe not, reducing the light, wear the blockers in the evening. The light is the most important stimulus for regulating circadian and behavioral systems. So there is internal body clocks that we have that regulate memory consolidation in our sleep. It happens at a certain point in the night. And if we're not sleeping restoratively and continuously, we're missing a whole chunk of that happening in our body and our memory issues. So remember, dementia is going up, rates of dementia, rates of memory loss, rates of neurodegenerative. We can help that by sleeping better, and we can sleep better maybe if we're avoiding some of these lights, but also seeing the sun first thing in the morning, sunlight in our eyes around sunrise can help us sleep better. So again, all of this is it's healing our bodies, it's regulating our metabolism, it influences our sex hormones. All our hormones are influenced by the circadian rhythm, our digestion, our body temperature, even our performance. We have internal clocks on the optimal time to exercise, which is, I think, in the afternoon between 2 or 3 o'clock, which is really hard for a lot of us. So I'm not saying do all of it, but if you have some flexibility, figure out if you're better off maybe exercising in the afternoon, if as long as it doesn't interfere with your sleep patterns. Melatonin goes up at a certain point in the night. Cortisol goes up at a certain point in the early morning. So these are regulated by our exposure to the sun. So we need to be seeing the sun. This is also probably why we have seasonal affective disorder, because most of us don't see the sun very much at all when there's, in the winter. Our genes, there are genes that regulate this, and it's different for different people. This is why some people are morning people and other people aren't, but there's a center in our brain that actually is in charge of some of this. So fascinating information coming out on circadian rhythm. So who's at risk? So the people at most risk for this is also if you live at extreme latitudes, right? So there are some people who have darkness for 22 hours of the day based on where they live, and that's not great. Shift work. If I could, I would love for anyone over 40 not to do shift work because it starts to impact our metabolism, our inflammation in our body. Shift work in breast cancer has been linked to women who work shifts, especially under the light in the ERs, their rates of breast cancer are higher. Blind people don't have the ability to regulate circadian rhythm. Illnesses that affect sleep quality is also, going to impact the circadian rhythm. Illnesses like neurodegenerative. So not sleeping increases our risk for neurodegenerative, but having things like Parkinson's, neurodegenerative disorders, dementia can affect our sleep quality as well. Many medications affect sleep. Jet lag, if you constantly travel, persistent travelers, your time zones are all over the place, living in places where there's short days. And actually, our diets influence our circadian rhythm. Our stress levels influence our circadian rhythm. Eating after sunset can also be one of those things that can affect us. So, how do you know if my rhythm is off? Well, you don't know all the time. You wake up tired, takes you forever to fall asleep. Those wearable devices are great to see how your sleep pattern is. I would highly encourage people getting them. Watching heart rate variability. Heart rate variability measures the change in our sympathetic and our parasympathetic. It kind of watches on a regular basis what these two are doing. And heart rate variability that's high shows a higher parasympathetic tone. When your parasympathetic tone is high, remember we said the symptoms usually are less. Your ability to heal goes up. Your body's more resilient when your heart rate variability is up. So these are excellent wearable devices that you can watch these things. You can check for melatonin levels in the saliva, cortisol levels in the saliva, and you can watch your body temperature too. So these are ways to tell if your rhythm's off. Okay, so what's the practical implications of the circadian rhythm? Morning bright light therapy. If you're in a place where you can't get sunlight in the morning, use one of those happy light boxes and get some sunlight into your, not into your eyes. Don't stare at this box, but work around this box because that light coming from the box is really bad for our eyes. But if you're able to go outside in the sunrise and sunset, watching sunrise is an amazing way to reset our circadian rhythm. Watching sunset is an amazing way to reset us. Use a happy light. Mood disorders can be highly benefited from this. Time restricted feeds, eating before sunset, eating in a window of 6 hours or 8 hours has been helpful. Exercising, like I said, in late afternoon. Even there's data on when to take your cancer therapy. It turns out that our immune system and our response to things like chemotherapy does better at certain points based on which chemotherapy it is. And there's articles about this, and I've listed a reference. Circadian pathways. So, it does affect our neuroendocrine pathway. This is our regulatory system for our brain, and it can increase our risk for neuroendocrine disease. It can increase our risk for cardiometabolic pathways, immune disorders like autoimmune disease. Even cell cycles can get affected by us pushing past circadian rhythms like cancers. So blue light is not a detrimental light all the time, but it can help with alertness, performance, it reduces reaction time. So athletes tend to have some benefit in sports, but for most of us, high exposures to blue and green light decreases our sleep duration and decreases our sleep quality. So also for vaccine optimization, right, where there's a lot of vaccines that people are supposed to get. Remember I said they go up as we age. There's more recommendations for vaccines. But if you're not sleeping, your vaccine optimization, your optimal value from that vaccine goes down. So the day before you're going to get a vaccine, get 7 to 8 hours of restorative sleep and get your vaccine in the morning. So how do we thrive? So we want to be more plant forward. We want to be having, we want to be able to have clean water. Again, things that we are in control of. There's a lot that's not in our control, and maybe not everyone can afford a filtration system for their home, but you can afford maybe a filtering system that's you could travel with. Yoga, meditation practice, prioritizing sleep, adding more movement, avoiding things of toxins as much as you can. If you need to buy organic, if you can buy it, great. If not, wash your foods out. Best quality of foods that you can eat. Eat lots of diversity. Add spices back, right? There's a lot of things you can do that are maybe change the time of when you eat. Maybe just go out in the sunrise every morning. Just start somewhere. There's a lot of ways to be resilient. And then create more pause and quiet in our life. Our life is constant with notifications, phones ringing, buzzing all the time. There's constant influx of news. There's 7,000 channels on Netflix and TV that we can watch. We're just constantly bombarded. And our body gets tired. Our mind-body connection goes off. So just be more mindful. Maybe turn off some of those sites like Facebook or Instagram that you're constantly checking. Maybe put your phone away. Maybe eat slower. Maybe take some more quiet time. Be with nature. Maybe start journaling. Be more contemplative. Add reflection. These periods of quiet are really good for our nervous system and our immune system. So my journey again, poor family history. We have multiple illnesses. There was type 2 diabetes, there's thyroid disorders, there's cancers. Again, I was scared that this was my destiny. So I started some of the, my lifestyle stuff I've started a long time ago. But recently I added some genetic testing and I found that I was at increased risk for multiple medical problems like diabetes, hyperlipidemia, and obesity. This is probably one of the reasons I couldn't eat pasta after a certain time because I just felt horrible. And basically, the symptoms of fatigue was the reason that I went on my journey for functional medicine. I wanted to find out ways that I can optimize my energy. And then I came to realize that I am a stress monkey. So I used a lot of mind body techniques. I have a daily practice. I go out in the sun in the morning, I walk in nature. There's a lot I've done, increased my optimism. So that has been my personal journey on some of the things that have been hugely helpful for me were fasting. Things that are 4 or 5 days of water fast tipped me. I was always pre-diabetic, regardless of being a triathlete, an endurance athlete. I was pre-diabetic. I didn't sleep restoratively. And I just was very stressed. So when I started adding mind body techniques and I started to add periods of fasting and added more quiet in my days was when I started to see huge changes in my concept of being well, but also in my numbers. And so again, one of the biggest things with that was also the elimination of dairy. Cold therapy was very helpful for me. I can talk about this later. Using light blockers at night, getting up to see the first light. So these are some of the interventions that I found were very helpful on my journey. So nourish your gut bugs, use the parasympathetic. This was just a recent article I just want to leave everyone with that showed that lifestyle interventions really made some significant difference in improving the quality of mild cognitive impairment, which is kind of the precursor sometimes to dementia and memory loss. So they found that the effects of intensive lifestyle changes were very helpful. So when they looked at whole food, minimally processed plant-based diet, moderate aerobic exercise, strength training, all the things that we really uh, talk about stress management, meditation, stretching, breathing, imagery. These were some interventions that were made significant differences in people's memory. So just hitting home on a recent article that was published. Okay, so what is your next steps? What was your why? Why did you start this call? Why did you come on this? Why are you here in this conference, this summit? What do you want to take home? So maybe make one intervention that spoke to you, and maybe start it on Monday. Call someone to make you accountable, tell them what you're doing, or you can maybe one of the things you're doing is you're just going to see more people. Maybe you just need to make connections again with people that you haven't seen in a while. Again, that loneliness issue is a problem. Eat with someone, start in sitting in the sun, put away your phone 2 hours before social media. Just start a breathing practice. It doesn't matter. It can be very small and it can be two or three, it could be one, but I'm telling you that these things kind of add on to each other. So it's really okay to just start with one small thing. Okay, how do we actually monitor how we're aging? Because it's a very interesting concept. You can look at obvious markers for some of the illnesses that we see, cardiovascular. We can make sure that our weight is optimal. We can look at body mass index. We can look at our visceral fat to see if that's growing. We can look at markers in the blood like C-reactive protein, insulin, fasting, hemoglobin A1C, which is sugar. These are all examples of when inflammation happens, what we see in our body. And these are markers that you can ask. There's also specialty tests. These are True Diagnostic is a special company that looks at the biomarkers of aging. So you can get from them um, a number of what your biologic age is versus your chronological age. And you can see if your body's aging faster or slower. And you can make interventions and then retest yourself to see if it's helping you age better. You can look at things like telomere health, which are the end caps of chromosomes, which are very They're very long when we're younger, and they tend to shrink as we get older, and they keep us resilient. So the sicker and older we are, they tend to be shorter. But if we can make them bigger, like with the Mediterranean diet or with a mind-body practice, which has been shown to increase our telomere length, we age better, we become more resilient. We can look at specialty proteins like tau and our risks for Alzheimer's. And we can look at genetics that look at our risks for Alzheimer's and things like that. So these are some of the ways that we can, this isn't working. Sorry. Okay, how to monitor aging. You can look at grip strength. The strength in your hands is a marker for the body strength. You can look at muscle mass. You can look at how you perform on a treadmill. You can use wearable devices like Oura rings and things to see how well you're sleeping. You can look at watches. I forget the name of the watch, but you can look at wearable devices that look at heart rate variability. Again, we want those numbers to be higher. You can look at the quality of your food. Your stool, am I going regularly? What does my stool look like? Is it formed? Is it bulky? Is it pellet-like? That is a function, that's a gut microbiome, kind of an objective way to look at your gut. And you can look at height, waist. It shouldn't be weight ratio, it's waist ratio. We're supposed to be um, if we're supposed to take our height in centimeters and basically be half of that or less as a waist circumference for aging better and for better health. So those are the foundations. We want to build the good roots through our lifestyle, and it will just help us age better. It's going to give us beautiful leaves on our trees and help us to just keep growing and keep learning and be out in the sunshine and enjoy our lives better. So thrive and improve our health span. So I hope some of that was helpful. And I'm going to stop sharing my screen.
Great. Thank you so much, Doctor. Really appreciate all the information that you shared. Before we begin with the Q&A, where can people find out about how to get in contact with you, to follow your work, also to get your book?
So Body on Fire book is on Amazon. And my website is called rawwellness.com. That's my website for my center called Shakti Health and Wellness Center. I'm in Maryland. I do telemedicine and I see people in some other states, but not all of them.
Great, thanks. So in your talk, you talked about fasting. How does fasting as a lifestyle intervention potentially influence gene expression and overall health?
So there are certain genes that actually turn on called FOXO genes that make us more resilient to things that are coming at us. So we are living in a world of oxidative stress, which are stressors that impact us, whether it's toxins or chemicals or our lifestyle choices. And those interventions, those stressors on our body, make them more resilient by activating these genes that influence how we age. So we may not be brought down by them because we're more resilient, and that's the whole goal. So fasting affects those class of genes, but more importantly, fasting also resets metabolism. It helps with our glucose control. So remember, the crux of illness, a lot of illness is insulin resistance. And so when we start to do interventions that work on that insulin resistance, we start to make huge leaps in turning on and off genes that are effective. So there's multitude of genes that are affected by insulin resistance too. So, but the FOXO genes group has been associated with the fasting concept.
And one of the challenges I've heard people talk about with fasting is they're ravenous after their fast. What are the smart ways to refeed after a fast to avoid, overeating, putting
Yeah.
more weight on because you're so hungry type of thing?
So I think two concepts of what you eat and when you eat are important. So, depending on who you are and how active you are, what your goals are. So, for example, if I wanted to be someone who wanted to improve my muscle mass, I wouldn't fast for too long, too often, because I would lose muscle mass based on me not eating enough protein or fiber. So those are the two food groups that I feel like people should focus on, even when you're not fasting or fasting. But specifically when you're fasting, you want to get in enough fiber and protein because they're both natural GLP-1s. They keep us full. And so when we're eating, so the GLP-1 drugs, remember, are the ones like Ozempic. Everybody and their mother's talking about them because they help us lose weight, they help insulin resistance, they prevent heart disease, and they keep us full. So natural GLP-1s are protein and fiber. So if we can eat predominantly in those two groups, I'm not saying that people have to be paleo or keto or whatever. You can eat vegetables and you can eat all of that. But my point is that if we focus on those things, we tend to be less hungry. The other thing is that we're hungry because we're thirsty sometimes. So making sure we're drinking enough water, and most of us are not. Most of us should be drinking half our body weight in ounces of water, which is just not happening for most of us. So it is a really important concept to be very well hydrated. You'll be amazed that at the times that you think you're hungry, but you're actually thirsty. And so drinking lots of water. And then when you do things like a 5 day water fast or a Prolon, obviously in 5 day water fast, you're drinking water. But with Prolon, also when you're doing the fasting mimicking diet, you drink, one of the things you're doing is you're getting through 32 ounces of water, specifically multiple times in a day. And so that's when I understood when I started doing Prolon that I was drinking very little water, and just drinking water makes me full.
Great. And so with regard to chronic stress, how does that impact epigenetic changes that may increase disease?
Okay, so the concept of stress, again, when you look at it from a gut microbiome, gut brain axis, we absolutely can change our genes based on the stressors that we are perceiving. And they could be real stressors, like, my house, there's a hurricane and I have to evacuate. And then there's perceived stressors like, oh my gosh, I'm going to see that uncle that drives me crazy, and the perseverate on those stressors. So some of the stressors are in our control and some of them are not. But what our brain thinks directly impacts that vagal tone. What our vagus nerve does is also impact the way we digest and affects our gut microbiome. Our gut microbiome is kind of like the gatekeeper for those genes that turn on and off inflammation. Remember, inflammation is the root of most of these chronic illnesses. And so if we turn on that inflammatory gene complexes, whichever ones they are, it's not so important what their names are. It's just important as a concept to know that our vagal tone, our gut health, is directly responsible for our immune system. And so we need to really take heart that resting and digesting, and it's not just about sleep, it's how am I walking around all day? Am I constantly aware, like afraid of the next thing that's going to happen? Or am I living in the moment and trying to just be present and not worry too much about the past or the present? I'm not saying it's easy. It's been a lifelong journey for me, and I'll always be a student in it. But it is so important to know that that's in our control, because a lot of us feel like there's always going to be stress. There's so much stress. There's so much stress out there. That is true, but we are in charge of how we let it affect our body.
Great. Thank you. So, with regard to fasting, you mentioned, if I saw that correctly, 2 to 3 days within a week. Is that, are you talking about like, so like two,
Periodic fasting.
yeah,
So that's a little bit more challenging. You can do, 36 hours for some people. That seems to be easy. I found that in my women in perimenopause, menopause, that seems to be a something that shifts their metabolism. Where if they're doing that periodically, it's starting to affect some of the weight loss. Growth hormone levels go up, and it's one of those things that you shouldn't do something that's just going to make you overfeed the next day. So I use it as a tool. I don't think everybody has to do it every week or anything like that. I bring fasting in or some sort of detox program in every season, because I think it's an ongoing process of cleaning house, because we're not all making the best choices, including myself every day. We're not able to make the best choices every day. We're bombarded by things and outside of our control. So we do like a reset every 3 months, every 4 months, something like that, even twice a year. It doesn't matter. But it's a concept that I think it is dependent on your goal. So if you're a muscle, you're a menopausal woman and you're trying to build muscle, you want to focus on eating more protein and fiber. And then the days you fast, or if you did a prolon, you will feel more full after the fast to eat more fiber and protein, and making sure you have enough water. So um, that's kind of, I'm not sure if I answered your question, I'm sorry, but it's sometimes 36 hours, sometimes it's 2 or 3 days in a row, but it's not every week.
And what are the best foods for refeeding though? I've heard berries, watermelon. What are your thoughts on that?
Yeah, I mean, for refeeding, I don't think after 36 hours it's that important as it is after 5 days. If you're doing a water fast for 5 days, the refeeding day is very important. That should be soups, that should be easy to digest things, that should be watery, that should be just simple things that are easy to digest. And then you can incrementally increase the difficulty level of the food, like raw foods and things like that. Well cooked foods is also okay usually. But it depends. I don't know that I'd have a steak or something like that hard to digest after a fast. Usually, by the time you're done with 5 days, you don't want to eat that anyway. But it's kind of like you're resetting your whole hunger pangs as well. But that is a very good question, and there is a whole science behind refeeding. I found it to be very individualized, though. But in general, you want to slowly graduate back up to your regular diet over a couple of days.
And at what point during a fast as far as how long it is, should you consider it having it be supervised by a professional?
After 5 days.
Thank you.
I don't think you should do anything on your own for more than 5 days because you can get electrolyte abnormalities and you really should be True North, I think, is they watch people for up to 30 days, I think they're doing.
But
But it,
we'll have
over
Dr.
five,
Hammer speak.
yeah,
Yes,
you should really shouldn't do it after 5 by yourself.
perfect. Thank you. And what is the epigenetic impact of practices like yoga and meditation on stress and inflammation?
So yoga and meditation have actually been shown to not only affect the genes turn on and off, but also increases our telomere length. So telomeres again are those end caps that are helpful for resilience and how we attack illness going forward and how we age. And so if we can build them because they shrink as we age, and the shorter they are, the more we're susceptible to illness. So things like yoga and meditation have been shown to increase those telomeres. So right there, you're aging better. Um, I don't know specific genes that get better, but I do know that again, these kind of concepts help with lowering your cortisol. They help that mind body connection, which helps the gut brain. And so there's a beautiful feedback loop on telling your immune system that and your parasympathetic system that's all is well. And simply you just heal. When your parasympathetic system is higher, your heart rate variability is higher, we just heal better. So our body's always trying to fix the problem. And so you're just allowing that to happen more when we're more in a parasympathetic state.
Thank you. So I saw gout on one of your slides, and can you tell us what gout is? And for people who are plant-based, who don't eat meat and whatnot, what could be contributing to an issue like gout?
So gout crystals, uric acid crystals in the joints is what gout is specifically. Uh, and it is a function, it has been shown that high uric acid levels are an independent risk factor for heart disease. And it's been associated with an immune marker that sometimes goes up with inflammation. So it's not just about the foods we're eating, it's about the immune cascade that's turning on in response to something, whether that's long haul COVID or some infection or some toxin that's in our system. You can have an elevated uric acid. So typically, when I see uric acid, we go over the diet that's avoiding, the purines and things like that, but we also talk about inflammation and what is inflammatory in that person and what is the problem in that person that's revving up their immune system. So it could be an infection, it could be a chronic virus, it could be a chronic toxin, it could be a vaccine injury, like something has caused that uric acid to go up.
All right, great, thank you. And you talked about sleep. So there are a lot of people who say they can only sleep 5 hours and that's all that they need. Are there people who just need less sleep or
Yeah.
okay,
I think there are, but I think it's very few. And I feel like if people think that they are, they should wear an Aura ring and they should get those metabolic numbers checked because they may be hugely surprised that they're pre-diabetic because they're not sleeping enough, right? You don't feel some of these things until it becomes an issue. And so I think that we're genetically different, but I feel like that's a very small subset of people who only need 5 hours of sleep. The majority of people are going to need between 7 and 9. And it's not just the hours, it's the quality. So I'm a big advocate of You may only need 5 hours, but are you sleeping? Are you getting REM? Are you getting into deep sleep? Are you getting restless sleep? Because that is going to make you age faster. And that's also going to give you more metabolic issues. And so when you do markers, I have people who are perfectly healthy on the outside, they do everything right, and they're pre-diabetic. You're saying, why am I pre-diabetic? Well, then we go back to sleep. This is why I start with sleep, because most people don't think about sleep. They're like, it's not a big deal. I'm going to just take care of that later. But it's just so integral to everything we do, which is your weight and your muscle mass and your blood pressure and your heart risk. And so I would say that please check out all those things I listed on those slides to make sure that none of those are off, because you may think you need 5 hours, and also check our objective measurement of how you're sleeping and what you're getting. And look at your heart rate variability, because you may be surprised that they're not optimal. And so that's an important thing to consider.
And what about naps? Is that a healthy thing for people to do? Is that detrimental to our nighttime sleep? What are your thoughts on that?
So I think it depends on the person. So there are some people, because of their chronic illness, say they have dementia or Parkinson's, or they're on a medicine that's affecting their sleep, something is making them tired, and a 10-minute nap makes all the difference in the world. And so if it doesn't affect your nighttime routine, some people take a nap and they're like, I can't sleep. I think it's more important to be able to sleep around the circadian rhythm, but it's okay if it's not affected by a nap, because there's a there's a hormone that kind of builds up in our body as the day goes on, and it's like a pressure cooker. And so we need to have high levels of it by the time we get to bed. And when we release it, for some people, when that release happens with the nap, they're just not as sleepy when they get, because that pressure cooker, that valve has been released, and you don't have enough. But in other people, it doesn't matter. A 10-minute, 20-minute nap usually doesn't hurt them.
Is that adenosine? Is that
Yes.
okay? And how does coffee impact adenosine and the time we drink coffee and caffeine impact our ability to sleep later with regard to adenosine?
Right. So adenosine is the hormone that kind of makes us sleepy. And by the morning, it should be getting out of our system. When we take caffeine, we abruptly, temporarily stop it from entering our cells. So the body thinks there's no adenosine, but then when that caffeine wears off, we're tired again, because we're not allowing that adenosine to 90 minutes after we wake up, around that time, the adenosine naturally goes down. So we want the natural aspect of it to happen, so we're not artificially lowering the adenosine with the caffeine. And there's also genetic variations in how we metabolize caffeine. So it's not always right or wrong to drink coffee. People always ask me, is it affecting my blood pressure? Should I stop caffeine? It depends on your genes, which I don't think you need to check. If you're someone who can't drink caffeine at 12 noon because it keeps you up at night, or you're someone who can have an espresso shot and then go to bed and you sleep perfectly fine, it's a gene variation. But in the mornings, we should wait about 90 minutes before we have caffeine.
Great, thank you. And you spoke about visceral fat in your presentation. What's the difference between visceral fat and subcutaneous fat with regard to
Subcutaneous, yeah,
metabolism?
subcutaneous fat is fat you can pinch. And it's not as dangerous. It's a little bit more unsightly because we don't like that, but the problem is that the visceral fat is the fat around the organs. That's where the real damage happens, because those are inflammatory. It's kind of like an organ of endocrine. It's a hormone and inflammation releasing thing that kind of recruits more inflammation to it. So that type of fat is very metabolically active, which means that it actually can increase things like insulin resistance. It can make things like metabolic issues like high blood pressure, high triglyceridemia, low HDLs, higher blood pressure. It can actively do those things in us when we have more visceral fat. And we can't see that. That's why those measurements with those scales are important.
Thank you. And you mentioned exercise, and I think you showed a range. I don't know the exact time, but it was later in the
Oh,
afternoon. What's the ideal time to exercise, and why
so
should we avoid
this,
it?
yeah. So this is fascinating to me, because this is based on the literature around the circadian rhythms. They've mapped out optimal times for exercise, endurance, and adrenaline. It turns out to be like 2 to 4 in the afternoon, or 2 to 3 in the afternoon, which I think is a ridiculous concept, for most of us can't do that. But I find that some people who do exercise in the afternoon can't sleep at night. So it just depends on you. I mean, there's an ideal, quote unquote, for people. I feel like it's so personalized that you should find out what time is better for you. Like for me, if I don't do it in the morning, I'm never going to do it. So I can't change my schedule. So it's just a kind of a fascinating tidbit of like if you're thinking about, hey, when should I try to start exercising? Because I don't exercise, and you have that ability to do it in the afternoon, maybe you can start there. You might find your endurance is better, your stamina is better.
And you talked about blue light glasses to
Mhm.
blockers. What should we look for in a pair? There's a whole bunch of different stuff on the market. How do you know what's good and what's not good?
Yeah, I think there's a company called EMR Tech that I like a lot. I don't actually know what they have versus another companies, but there's a percentage blockage that they have and it's listed on their website. But they're a very reliable company. And it is a big problem. You can also block it on your computer screens with a website called Iris, where you can just download it and it blocks your computer so that you're not looking at the blue light. You can do the same setting change on your phone with the color filter. So you can block those things on a regular basis, but the light is for like the ambient light around us. And ideally, when you listen to people like Justine Stenger, she does a lot of work with circadian rhythm. She talks about after sunset, you put those glasses on to block all the blue and green light, which affects our circadian rhythm a lot.
Great. And you mentioned the gut microbiome is key to our immune system. How can lifestyle influence the gut microbiome and subsequently affect gene expression?
Wow. Okay. So, the fundamentals of that is that everything that happens in that one scale that I showed, that balance between our stressors and our resources, that whole system needs to be in balance and check with multiple lifestyle interventions, right? So those immediately affect that parasympathetic system, which is, remember, the rest and digest, and part of the digest is the microbiome. So when we keep those things in balance with our lifestyle, so I lecture a lot to plant-based communities, and overwhelmingly people come up to me and saying, why am I still sick with X, Y, and Z when my diet is pristine and amazing? And so they're feeding their gut microbiome. So in that scale, they're doing one or two or three of those things, but they're walking around stressed out of their mind. They're not sleeping, right? So all of these interventions, the cortisol, the signal of the mind body, the vagus nerve, what our input to our vagus nerve, which directly impacts that gut microbiome, directly impacts that gut brain axis. It is so important for us to factor in the signals we're giving the gut microbiome. So for me, what the aha moment was my stressor. I didn't know that me being stressed out of my mind all the time was affecting my gut bugs, which was affecting my genes, which was affecting me turn on and off. And the only reason I know all of these things is because I've been doing some of the tests that I listed, where I'm looking at my biological age and my chronological age and my interventions and what is changing my aging patterns. And some of these interventions I do, it's been great to be able to watch those changes along with the blood work. So it's very variable for each one of us, but in general, all of those lifestyle changes that we've listed seem to support oh shoot, my battery might die. It seems to support the balance of the vagus nerve, which directly inputs into the gut microbiome and keeping it happier.
Do you want to plug your computer in so your battery doesn't die?
Yes, thank you.
You're welcome.
Okay, it's right here. All right, it's right here.
All right.
Okay,
And
go ahead.
all
I
right.
don't know
So
if I answered your question. I'm sorry.
no,
Um,
you're that's all good. So so along the same thing with gut health, what are your thoughts on the store-bought probiotic supplements? Do they work?
I mean, when we're talking about 100 trillion colonies and you're talking about 1 to 6 strains, I'm not sure. It kind of comes into my concept of recovery and health isn't going to come in a pill, whether that pill's a supplement or a prescription. I don't think it's that easy. I feel like if you're mostly well and you're doing all the right things and you got a little bit of gas, you may be able to try one of those and it gets better. I'm not saying it's wrong. I just don't think it's the whole picture. I feel like you still have to do work and figure out what's off balance and try to fix those things. And sometimes when you're mostly in balance, yes, it will work. It'll help you. But it doesn't work for everyone.
And so what happens after, let's say you need to take a course of antibiotics and therefore you've disrupted your microbiome? What are
Yeah,
good
I
ways
mean
to
it's
cover that?
Yeah, it's a real problem, but in general, probiotics are not thought to be helpful anymore. With that, prebiotics are. These are the fuel for the gut bugs. Prebiotics are the food, and postbiotics are the things that the gut bacteria make. They're called short chain fatty acids. One of the benefits of our gut microbiome and the diversity is that they make these metabolites that are very helpful for our body for healing. For example, something called butyrate is a postbiotic. It's something that our gut bugs make under the class of short chain fatty acids, and it's a direct input to the brain. But it also heals our endothelial, our cells within the gut. So butyrate and prebiotics is what I recommend when patients take antibiotics, and I have them continue it for a few months because those are healing. It's not, and resistant starches, but it's not thought to be effective or recommended anymore to take probiotics with your antibiotics.
Great, thank you. And in your practice, have you observed cases where significant lifestyle changes have seemingly reversed or halted the progression of what was seemingly thought to be a genetic linked disease?
Yeah, so if you look at something like rheumatoid arthritis, which is genetically based, my co-author, Monica Agarwal, she basically, in our journey, in our book, she talks about it. That was one of the reasons we wrote the book, was because she basically reversed her RA based on those lifestyle choices that we've listed in the book. I see it in the practice. I think that it's a little bit more complicated. Not everybody's journey is the same. I would say that it definitely helps symptoms and recovery and maybe lowering of doses. Most of the time, we get people feeling significantly better. I just don't know about everyone reversing it, but there is definite benefit and a sense of wellness and increased health span when people do make lifestyle choices.
And so we have a few minutes left. If you can, if you can talk about like you've given us a lot of stuff. If somebody had to choose, let's say, three things to start off with to make it more accessible to the general public, what would be those three things on any of the topics that you spoke about that you think would have the biggest bang for the buck and hopefully promote, going deeper into their health journey?
I think circadian rhythm is blowing my mind. Like it's one of those interventions I feel is so incredible. And we all have access to sunlight at some point or a happy light, and blocking those blue lights and things like that. Wearing getting glasses. Maybe you don't need to get the glasses, but still put the filter on your computer, put the filter on your phone. The glasses are something like $30, but really getting out to see the changes of light, the sunrise and sunset is invaluable. And getting out in nature, it's just huge. The second thing I feel like is watch your sleep. Everyone's going to be shocked at how hard it is to get a good night's rest. And so that's why I like the circadian rhythm and sleep, anything that helps your sleep. So trying something maybe like a meditation practice, a breath work, something that would help your quality of sleep. And then the third thing would be obviously maybe, so it's hard for three, but maybe the third thing would be watch your diet. Like look at the quality of your foods. It doesn't mean it doesn't matter that you're on a plant-based or carnivore. Just look at the quality of your food. Make sure that it's pesticide free as much as possible, not organic necessarily. Wash off your foods and fruits and vegetables and good quality meats, like the best version of the food as possible that you can help, with your finances and things like that. But those are three basic things I feel like everyone can start. It's hard to rank them because I feel like everyone's journey is so personal. But that's why I asked in the beginning the why, because based on what your issue is, I have a perfect diet, yet I feel so bad. That kind of thing. Your diet is not where you would start. You'd start with maybe something else. Like, why am I so stressed out? Oh, I'm so stressed out all the time. Maybe I'll start with the breath work. But I think everyone can do circadian rhythm. That would be a really cool thing to start with.
Great. Well, that concludes our time. So I want to thank you so much for all the information that you shared with us today. If we
Thank
can
you.
mute the audience, please.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Will do.
For this
Will
meeting.
do.
Love to talk
All
to
right.
her,
Thanks a lot.
exchange ideas.